But I want to say at the outset that although we've seen significant success since the initial launch of our vaccination program, we're accelerating registrations, we're getting more people vaccinated, we have a new supply of AstraZeneca that has been secured, and we're committing that to making sure that our frontline workers get the support they need. And of course, Dr. Henry, Minister Dix, and the entire health team are focused on using any of the vaccination products that we do have that are not committed to our cohort system, starting, of course, with the 90-year-olds, which are now done, into the 80s, and now we're registering 70-year-olds, and by the first week in April, we'll start to register those in the 69 to 60 cohort. So with respect to the Pfizer and Moderna product that we have in increasing numbers coming from the procurement by the federal government, we also have AstraZeneca that we are using to focus on outbreaks, and we're using it to focus on those frontline workers. And I want to just say I'm so proud of the work that everyone across the province has been doing to get out of the situation we've been in for the past 12 months. All of us are tired of this. They're just exhausted with COVID-19. But we are not out of the woods yet. We have several more miles to go before we rest. And I want to just keep reinforcing that with people at home, that although there is extremely good news on the horizon in the weeks ahead, we still have weeks to go. And I want people to be very, very mindful of that. Although all British Columbians have risen to the challenge over the past number of months, I want to pay particular homage today to people and businesses who have been trying to do their part to make sure that we meet the objectives of having everyone who wants to have a vaccination done as quickly as possible. And when we think of the hardest hit industries, of course, right at the top of that list is our tourism sector, and our hospitality industries as well have seen a reduction in their ability to serve customers, and that has led to declining employment in some sectors. We today are announcing a program that we put in place with 14 businesses across the province, taking advantage of that superior hospitality the tourism sector is so renowned for here in British Columbia, to make sure that we can put some of those furloughed workers back to work. Some 1,400 laid off tourism and hospitality workers will now be doing non-clinical staff work within our immunization centers. And Dr. Ballem will talk about some of those details in a moment. But I just want to say that it's with the assistance of these workers, some 1,400, as well as the countless volunteers that have been stepping up to say, how can I participate in the end of COVID-19 in my community? It's really quite heartwarming. I spoke this morning to Jennifer Rice, the MLA for North Coast. She's in Prince Rupert. She's also the Parliamentary Secretary for Emergency Preparedness. So she has spent the past number of summers going to communities that are dealing with floods, dealing with wildfires. So she knows firsthand the impact that emergency and crisis can have on the fibre of a community. And of course, in Prince Rupert, we had months and months and months of no cases, no evidence of COVID-19 whatsoever. But in recent weeks, we've seen an increase in caseloads. In fact, a startling increase that led Dr. Henry and Dr. Ballem to make the decision to immunize the entire community of Prince Rupert and Port Edward. And that means somewhere in the neighborhood of 10,000 people were in line to get vaccinated. And Member Rice reported to me this morning that 85% of the people in Prince Rupert have received a vaccination to this point in time. There's euphoria in the town that has been in dread, quite frankly, over the past number of weeks. And of course, the Journal of Record in the North is not any of the major newspapers or the major television networks. It's Facebook. And on Facebook, you can see from people in Rupert and the environment talking about how proud they are of the work of the community to step up. 400 volunteers stepped up without any advertising, without any prodding, to come and help. And that's the attitude we're going to need in communities right across British Columbia as we go through the next number of weeks. So I want to talk a little bit now about the 14 companies that have stepped up to help our health authorities and, of course, Dr. Ballem meet our objectives. Our co-pilots in this endeavour are Air Canada, WestJet, of course, YVR, the Vancouver International Airport. Our teammates in this endeavour are the Vancouver Canucks, the Vancouver Giants, and, of course, the Fraser Valley Bandits. And, of course, community organizations like the Pacific National Exhibition, the PNE, Ceres Marine Terminals, providing employees to help us, Tourism Whistler, Destination Services Pacific, the Pavilion Corporation, as well as the Red Cross of Canada. And that's just to name a few. There are industry groups like the BC Business Council, the BC Chamber of Commerce, all offering to help deliver on what is the most extraordinary undertaking we as a community have ever taken. These are challenging times, but they're also inspiring times. And we have two people joining us today, Baljinder and Kathy. We'll talk, Baljinder from WestJet and Kathy from Ceres Terminals Canada. But before I ask them to offer their thoughts on how they feel about participating in this extraordinary community endeavor, I'll ask Dr. Ballem to give us an update on where we are with respect to the vaccine programs, and then we'll get into our friends who are helping us out on the way.
Thank you so much, Premier. It's just a pleasure to be here today and to celebrate really the ramping up of our mass vaccination program all over the province, as you said, and particularly to celebrate our partners, both in communities and in our business sector, our local governments who have all stepped forward to actually help make this a success. We have partners that are helping us get the word out, address vaccine hesitancy, help people get to our clinics. We've got different partners who are providing us with facilities to host our clinics. And today we really want to celebrate a remarkable group of companies and organizations across the government, private, and nonprofit sector who are actually bring remarkable skills to our ability to ramp up vaccination programs and run these very complex vaccination clinics. As you mentioned, these are companies that have suffered significantly in the last year of this pandemic, and many workers laid off and unable to do their normal jobs. And we are just extremely grateful to have them stepping forward and bringing their incredible skills around welcoming people, managing the flow of large numbers of people through complex venues, and just providing that environment that they do every day in their normal jobs, and placing that in our clinics to welcome our public as they come forward to get the vaccine and to get hope again that their lives are going to return to normal. So the skills that they bring have made a big difference, and at the same time they've trained many people to work in our clinics and do a terrific job. And I think we all have heard from many members of the public, and particularly our elderly citizens and residents who are the first to go through our age-based clinics, just how delighted they have been with their experience and how emotional they are with having been received with such compassion and such care and getting themselves vaccinated, and hopefully back to hugging their grandchildren, being able to see their families again. And as you said, Premier, following the next weeks that are still going to be difficult to get British Columbia back to normal. So we see this as a Team BC approach. We're very appreciative of the contributions. And across this province, as you know, we've ramped up our vaccination. We've just really surpassed the 500,000 landmark of people vaccinated in British Columbia with their first dose. And we're very happy and just very grateful for the contributions of all members of our community, and particularly these 12 great organizations.
Thank you for that, Penny. And of course, Penny will be available for questions once we complete our presentation today. But I want to call on Baljinder Sandhu, who works with WestJet, and I want her to know that there's just a few people watching, hardly any, and we're grateful that you're excited about the challenges ahead, and we invite you to have a few comments about what this means to you as part of WestJet and how you're dealing with the extraordinary challenges over the past 12 months.
Thank you, Premier, and thank you, Dr. Ballem, for this opportunity. And we know the pandemic hit hard, not just us, but everybody, not just the airline industry, but the whole BC, the whole world. And it impacted so much on us from all these WestJetters getting laid off from furlough, for reduced hours, like myself. I am on reduced hours. I went from full-time to part-time, and that impacted us dramatically. And then WestJet came to us about a month ago, and we understand what WestJet had to go through. We totally understand. And then WestJet had the opportunity to help with Dr. Ballem and this project of the vaccination. And they asked who wanted to help out with setting up these clinics. And you know me, I was the first one to put up my hand. I'm like, I'll do it. And just to help us with our more hours and just to help the community. That's what WestJetters do. We love to help the community. And right now I'm working at with the YVR at the River Rock Casino. And so I've already been here for almost 2 weeks now. And to see all these people come in, grandparents, parents with big smiles, so excited to get them vaccinated, and they can see their grandchildren. Like the Premier said, we want to get BC back to normal and our airline back to normal, and we will do anything to help out. Thank you.
Thank you very much, Baljinder. And again, it's that the hospitality sector is so critical to our economy and also to our communities. And as you can see, having enthusiasts for British Columbia and for the vaccination program, they're ready to help out is quite significant as we go through the next number of weeks and, in fact, right into the summer. So I'm going to call now on Kathy DeLisser. She works for Ceres Terminals Canada. She is part and parcel of our cruise ship industry in Metro Vancouver and inviting normally many hundreds of thousands of visitors. That has, of course, been curtailed for this season, but that doesn't mean we don't have eager, enthusiastic people wanting to help us get back on track and get our tourism industry back to where we want it to be. So I'll ask Kathy to say a few words as well.
Thank you, Premier Horgan, and I'm pleased to be here today with you and Dr. Ballem and our friends from WestJet. And Ceres Terminals Canada is just thrilled to be participating in this program. Our cruise and our tourism industry has been hit particularly hard, as we all have said. And of course, with the continued ban on cruise ships into 2022, many of our staff are facing another year of unemployment. This partnership has meant that we've been able to employ with our cruise partners over 300 personnel and counting to be able to work in these clinics. Not only is supporting the staff and getting us back to work, but it's also immunizing our communities. And that's a very instrumental step in being able to reopen the tourism and the travel industry. This also keeps our tourism and our cruise partners intact so that when we can open to cruise and travel again, our teams will be able to stand up fairly quickly and get back to doing what we really love to do, which is welcoming guests and visitors into our regions and into our venues. Ceres is really pleased to be able to be supporting 5 clinics in both the Fraser Health and the Vancouver Health region. And I can tell you, we stood up our first site in North Delta on Monday. And it is so rewarding when you see people coming in and they're so excited to get their vaccine that they're smiling and they're laughing once they get it. And we know that this is going to be a really big part of them being able to get back with friends and family and what we want them to do, which is traveling. So we really, really thank you for the opportunity of this partnership because it is going to get our communities immunized and that gets them back traveling. So thank you.
Thanks very much for that, Kathy, and thanks to both of you for stepping up to help us get past what has been the most extraordinary of years. And as I've said repeatedly and will continue to say, we have a distance to go yet, but we are getting very, very close to the end. We've seen an absolutely unacceptable rise in cases, particularly in the Lower Mainland, in Fraser Health and Vancouver Coastal Health, but also in the north and on Vancouver Island. So we have to continue to follow the directions of Dr. Henry. The public health orders are not there to be punitive. They're there to keep us safe. They're there to make sure that we can get the vaccines we need. And as Kathy and Baljinder said, get back to regular life, getting back to the prospect of traveling, the prospect of seeing friends and family. I know tomorrow Dr. Henry's going to be talking about our long-term care facilities and how we're going to deal in the near term with visitation, which is something so critically important. I've heard from any group in my community of Langford One, if you can more than any others, it's children and grandchildren desperate to see their parents and grandparents. And we know that, we understand that. And Dr. Henry and Minister Dix will have more to say on that tomorrow. But for now, I wanted to celebrate our industry partners. I wanted to celebrate the volunteers, and I particularly wanted to thank Dr. Ballem for stepping up and taking on the challenge of her lifetime, which has been filled with quite extraordinary challenges. And I just am so grateful for the work that all of us are doing. Wherever we come from, whatever part of the province we live in, we're focused on making sure that those around us are safe and well. We need to follow public health orders. As we say, we're into phase 3 of the program, the cohort program next month. It's just around the corner. Let's stay focused. Let's make sure we're doing the right thing, quite frankly, to protect our neighbors, to protect our communities, and to protect our province.